Welcome to Freakonomics M.D. Podcast Summary. Episode 59, The Most Valuable Resource in Medicine. This podcast episode of Freakonomics M.D. features oncologist and researcher Dr. Chris Booth discussing the concept of time toxicity in the medical field. Dr. Booth explains that patients with cancer often experience a loss of patience due to the quickening of time caused by the diagnosis. He and his colleagues began thinking about how to best use time when it comes to health and how to quantify the opportunity cost of treatments. Dr. Adam Gaffney, another guest on the show, discusses the impact of the flaws in the U.S. healthcare system on how physicians and patients spend their time together. He explains that time is the currency of healthcare and that access to healthcare is often determined by a patient's ability to pay. The episode explores the importance of understanding the value of time in healthcare and how it can be used to improve patient outcomes. In this podcast segment, Dr. Chris Booth continues his discussion on the concept of time toxicity in cancer care. He explains that in oncology, meaningful gains are often measured by time, and how much a drug or therapy improves survival. He also highlights that while some treatments have transformative impacts on patients and provide large benefits, many have only modest survival gains that need to be balanced against the downside, which is the time spent pursuing medical care. Dr. Booth and his colleagues have studied time toxicity to help patients and physicians figure out the best use of their time when it's not clear how much time is left. They have proposed a formula to quantify time toxicity as a home day or a health system day, which would be used to estimate the number of days spent seeking treatment. Their findings have not been encouraging, as they show that the number of days spent seeking treatment may take away every added day of survival. Dr. Booth also suggests that measures of time toxicity should be routine across medicine and not just limited to oncology.